antidiuretic hormone because it opposes diuresis. Diuresis is urine production. When you're out for a night on the town, you're usually drinking a diuretic beverage, alcoholic beverage. Let's say you don't touch a drop of that stuff, what are you drinking? Usually a caffeinated beverage. Coke, not the kind you sniff, okay? Coca-Cola, all right? Or maybe tea or coffee, also caffeinated. And where do you spend part of that evening? In the bathroom. Because you're drinking a diuretic. You're dropping the blood volume, you're going to drop the blood pressure, okay? This is anti-diuretic hormone, so it opposes diuresis. It restricts urine production. You retain more urine, you build up the blood volume, you build up the blood pressure. This is also called vasopressin because it's a potent vasoconstrictor. When you have a major blood loss, the pituitary dumps large quantities of ADH or vasopressin in the blood. That causes vasoconstriction, helps to maintain blood pressure. So you get enough to the head. Otherwise you lose consciousness, lapse in a coma, and you could die as a result. But again, increase in blood volume, and also vasoconstriction by the same hormone, increase in blood pressure. Okay, we've got some more hormones. If you don't run out of things. Endothelium. This is produced by the endothelial cells, which are the cells lining blood vessels. And you can see, this in response to low blood flow, what it does is increase blood pressure. But those same cells can also produce another hormone called nitric oxide. NO is the chemical formula. It's also known as endothelium-derived relaxation factor, which tells you what it does. It's a vasodilator. So these same cells can produce a vasoconstrictor, endothelium, to bring up the blood pressure, and nitric oxide, or endothelium-derived relaxation factor, to dilate the blood vessels and drop the blood pressure. So these cells lining the blood vessels are very important, not only in the blood clotting process regulating the blood vessel repair, but also in helping to maintain blood pressure. Then we have inflammatory chemicals like histamine and chitins. These are released during inflammation in response to like certain allergens. They cause vasodilation, decrease in blood volume, increase in capillary permeability, and overall then decrease blood pressure. Alcohol, as I said, is a diuretic because what it does, it inhibits ADH release. It also dilates blood vessels, especially in the skin. That's why when you're heavy drinking, your skin kind of turns dark or reddish because you're basically dilating the blood vessels in the dermis. Overall effect, though, is to decrease the blood pressure because, again, you're dropping the blood volume. It's a diuretic. You're promoting more urine formation, drop blood volume, drop blood pressure. Nicotine, associated with tobacco products, this causes vasoconstriction. As a result, brings up the blood pressure. Okay?
I have a question. What would happen if you take an excessive amount of nitric oxide?
Take an excessive amount?
Extra.
Extra?
Yeah.
Well, you can see nitric oxide is going to basically decrease the blood pressure. So theoretically, it might drop it very low, to the point where maybe you don't get enough. You know, the blood pressure drops so low that maybe you're not getting up to the head, theoretically. Okay. Usually it's not significant enough to make that much of a major difference, or it could actually be damaging.
Okay, I use that stuff for like, if I go to the gym, I would use nitric oxide.
You use nitric oxide, basically, to drop your blood pressure?
No, it doesn't do that to me.
What's it doing for you?
It's probably mentally, probably gives me like more energy, like stamina.
Stamina?
Now you know where that's
I use it as
Well, it can increase your blood flow. It can increase your blood flow because you're dilating the blood vessels.
right.
Because it is a... Okay.
Yeah, exactly. It increases like your NO2 intake and stuff, you know what I mean? Stuff you actually absorb.
But the overall effect is, of course, decrease your blood pressure. But if you're exercising, you're bringing the blood pressure up too.
So it kind of balances.
So maybe
So
by...
will it just help with more oxygen?
Probably give you like
Will it
more
will
reps,
help
right?
with more oxygen?
Well,
It's just a
you need
gimmick
more
to
blood
get you to
flow.
buy it.
Just need more blood flow. What you want when you're exercising.
Basically.
So that's maybe why you feel the
Power.
problem.
It's just one of those things.
But like you say, some is right up here too.
Mentally.
Yeah.
As
You can convince yourself something works, and if you're convinced, it may just work. Or at least you feel it's working, right? So a lot of things they sell, in these health food stores, you know, may not exactly do what they say they're doing, but if they can convince you it does,
Right.
okay? Whatever. Okay, so we've seen blood pressure regulation short-term by neurostimulation, by the autonomic nervous system. We've also seen it with chemical stimulation, primarily by hormones. I'd like to know what those hormones do, increase or decrease blood pressure. But notice that the kidneys are the main provider of long-term regulation of the blood pressure. Kidneys not only extract waste products from the blood, that is metabolic waste generated by the cells when they metabolize, but they help regulate the blood pressure in the long run. And they do it by altering the blood volume. And they can do it what's called a direct method or an indirect method. Okay, the direct method, what they're doing basically is increasing what's called the renal filtration rate. This is the rate at which material comes out of, or I should say fluids, come out of the blood and pass into the kidney tubules. And following an increase in blood pressure or arterial blood pressure causing production of more urine. As you take more fluid out of the blood, you'd expect you're going to increase urine production. The result is you're going to get a drop in blood volume, and with it, a corresponding drop in blood pressure. That's called the direct mechanism. When the blood volume or blood pressure decreases, then this renal filtration rate, the rate at which fluid is coming out of the blood into the kidneys, decreases, less urine is produced. As a result, more water is retained. You maintain the blood volume and increase, or in fact, even increase the blood volume and can increase the blood pressure as a result of this. That's direct method, simply by taking more fluid out of the blood or less fluid out of the blood. The kidneys will adjust blood volume and thus correspondingly adjust blood pressure. Taking more fluid out, producing more urine, drop the blood volume, drop the blood pressure. Producing less urine, retaining more fluid, build up the blood volume, build up the blood pressure. So what we call the renal filtration rate. By adjusting that, the kidneys adjust blood volume and with it, blood pressure. That's a direct mechanism. There's also what's called the indirect mechanism. This is called the renin-angiotensin mechanism. It involves some enzymes and hormones. I think we'll wait on this because we're just about out of time. So we'll continue this, wrap this up on Thursday. Wrap up our discussion of